Good morning, all. It's 11 o'clock and we should get started. My name is Larry Jewell from the Edmonton Pride Seniors Group, and I would like to thank you all for attending our weekly Aging with Pride discussion group for 2S LGBTQ plus seniors and our friends and allies. We're presently in our third season, and I would like to thank our partners as well, Sage, where we are, and the Pride Center of Edmonton. Before I introduce the speakers, I must acknowledge that we are located on Treaty 6 territories and respect the history, cultures, and languages of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our lives. I will also let you know, don't know if anyone online, that we are recording this session for future use on our YouTube channel. So anyone online who doesn't wish their image to be recorded simply has to close the video for that. I think now I think an important topic, and I'm delighted to welcome today two speakers from the Canadian Frailty Network. Carlina and Laurence will review their Healthy Aging portal, which allows older adults to complete assessments at their own pace and or with assistance that if they need it, and thus they can strengthen their independence and access resources and interventions that are appropriate for them. So are you starting, Carlina? Thank you both for coming.
Thank you so much, Larry. That was a great introduction. Hi, everyone. My name is Carlina Mayer. So I actually work with Sage Seniors Association, but we are funded in this project through the Canadian Frailty Network and Maxwell Foundation. I'm the project manager for this program, but I've been with Sage for almost 10 years in various capacities. I actually had the chance to work with Eric as well back in the day. So it's really great to see him here with us today. And
my name is Laurence. I'm a research assistant for the project that we're working on. Yeah.
And I want to introduce some folks that are not with us, but very integral to the team. We work closely with Anne Summit. So she's at the University of Alberta Faculty of Nursing. She's one of the scientific directors on this project, as well as Tammy O'Rourke. So she's with Athabasca University, and she's also another scientific director. And we work closely with Megan Sutherland, who's our grants and evaluation coordinator and our research assistants. So our team is really a robust team of individuals who are working quite collaboratively on this project. And I thought it was worth mentioning them, although they are not with us in person today. So I thought I'd just give kind of a brief rundown of our agenda. In our session description, we talk a lot about the assessment, but I really wanted to actually talk about the project because the assessment is just one component of our research project. And there's a lot of other work that's being done that's really great in the community that is sort of outside of that online portal. So I want to just give a brief overview of our project, what makes this project within Northern Alberta unique. Talk a little bit about the project components and the scope of work, and then we'll talk about the tool that our team developed, the Healthy Aging Asset Index. From there, I'm going to give to Laurence, like he's going to talk about that Healthy Aging portal that was what Larry was talking about in the description, what that is, and how it's connected to CFN's, the Canadian Frailty Network's Avoid Frailty Framework, and then our Healthy Aging portal, what that is. And then I thought at the end we could just talk about kind of what you think of this project, some of the tools being developed, and really just kind of have a bit of a connection and chat. Awesome. Cool. Without further ado, I will give a bit of a project overview. So Sage has secured funding from the Maxwell Foundation and the Canadian Frailty Network, CFN, for the Northern Alberta Regional Centre for Healthy Aging project. So this project really builds on work that was done in our Dragonfly program, which is when we had health services. So a couple of years ago, Sage had a nurse practitioner-led health clinic. It was amazing. We had nurse practitioners on site. It was integrated with our life enrichment programming that Rachel runs. I mean, I see some head shaking.
Yeah.
Everyone knows it was a very amazing program. It was a pilot project, so at the end of the funding, unfortunately, there's a couple things and it did not get renewed, but our team works continuously to hope of the return of that program. And this work kind of is helping to position us in talking to government funders that continue that great work here. So within our health services program, and Summit and the team developed a tool to help us identify and respond to frailty in community. And when you use the term frailty, I think it's often a stigmatized term. We'll use it a little bit in this presentation, but our team prefers to use the term like building resilience or just helping folks to live well. And because when we think of frailty, we think of, there tends to be that negative connotation, but it is a medical term because we're kind of working with clinicians. It is kind of one of those things that we're trying to balance. So our team developed the Healthy Aging Asset Index, which is an assessment tool. We'll get into talking about the tool kind of further in our presentation. But really what it is it's a tool used to identify strengths and vulnerabilities across different domains of health that contribute to overall health and well-being. And by using this tool, older adults can identify areas that they really need support. So a lot of assessment tools look at things like physical capacity, cognitive capacity. What makes our tool different is we look at those social determinants, the social components, so social connectedness, not just those physical pieces. And as we all know, feeling connected is just important as physical health. In fact, it can influence physical health if someone isn't socially connected. So that's a little bit about the tool. Now, what is the RCHA or the Regional Center for Healthy Aging? So when we think of Regional Center for Healthy Aging, we actually think of a place, but really it's more of a framework or an approach. And it's an innovative approach to help seniors live well in the community. So it's comprised of a like-minded team of individuals in a defined geographic area who are dedicated to implementing and promoting a community-based program to encourage older adults to engage in behavior changes that promote healthy aging. And really an RCHA is about interdisciplinary practice. So working with social workers, working with nurse practitioners, working with researchers and community to do a more holistic approach to healthy aging. So essentially, like SAGE, RCHA is a dynamic community hub that fosters both collaboration, research, and proactive initiative to support seniors so they can help to continue to share their gifts and build our province. I have two screens. I'm trying to go ahead for. No, we're good. Sorry about that. I have too many screens going here. So I'm just going to give a couple of facts about the number of family physicians in Alberta, which I feel like you probably know. In Alberta, as reported in August 2023, the number of family physicians accepting new patients has fallen from a total of 887 in 2020 to 197 in 2023. In Edmonton, the location of our RCHA, our Regional Center for Healthy Aging program, physician availability has fallen from 285 to 33. Many of these doctors are hesitant to take on older adults due to the complex social factors affecting their health. And this is often the complexity of the social determinants of health, which is a barrier to effective support for seniors within primary care offices. So through our health services clinic and through research, we're finding that issues seniors are facing are better addressed in community by leveraging community resources primarily for social issues. So by leveraging these resources, we can create a more comprehensive and integrated approach to senior care that goes above and beyond just the traditional medical models. And that's why we're developing the North Alberta Regional Center for Healthy Aging. So it's a program led by SAGE Seniors Association, University Faculty of Nursing, Athabasca University, and we're one of 4 RCHAs in Canada. So there's an RCHA in Ottawa, Ontario, Quebec, and British Columbia. So what makes our specific site a little bit different is that integration of that tool that our team has developed, the Healthy Aging Asset Index. And really the hope of this tool is that we're able to mobilize and build on the strengths of seniors, but also so that we're able to streamline assessment practices and really implement interventions to promote living in the community and to hopefully identify areas that people can get support in and preventing them from going into further levels of care. So it's really a proactive approach that we're able to put interventions in place. Part of this project is through the streamlining of assessment tools and working with partner organizations, also use this tool within the organizations. It's an evidence-based tool that allows us to demonstrate to funders, the government, to folks in policy, the value that community-based organizations have. Because sometimes, as we know, demonstrating that value, we know the value as community members and as community-based organizations, but sometimes demonstrating that value can be challenging. This is one way that we can kind of bridge that gap, speak in that language that funders and government like to hear using this tool. Is there any questions so far? Okay, so we talked a lot about the project and it's a bit of a complex project. And so for me to best conceptualize it, I have it broken down into different areas. And what I thought would help was just talking about what this work looks like in action, just so you can get an idea of what our team is working on. So the first area is the psychometric testing of tools, which is really just a fancy word for ensuring that the tool that we've developed, the assessment tool, is validated by content experts. And it's so we have different expert reviewers testing the tool, providing feedback on it, and refining the tool. So at the end, we have a scientifically backed, evidence-based assessment tool, which is great. The next phase of this project is social prescribing interventions, which looks a little funny on the screen there. But really, that's about one phase was integrating this assessment tool into an online portal so that older adults can self-assess. And what that looks like is they'll go through assessment. Laurence is going to kind of show you more in depth, but just a little quick note. You just do the self-assessment, and at the end, you'll get a report that shows strengths and vulnerabilities, and then a list of community resources. Theoretically, that sounds great. But we're learning, there's many learnings. But maybe when Laurence touches on that piece, we can also maybe just discuss a little bit of the challenges we have with the self-assessment portion and the integration of the online portal. Because that was really through our funders Canadian Frailty Network. And it was one of those things that we kind of had to learn how to navigate the software, and we're still testing the self-assessment because there's a few kinks. But I'll put a pin on that, and then Laurence and I can maybe talk a little bit about that when we get. The other portion in social prescribing interventions is really taking the tool, and the tool we use it within SAGE, so our frontline workers, when folks come in, they'll do an assessment with an individual, they'll use our high tool, and then they'll kind of, depending on where that person may fall on that spectrum, they'll provide different levels of support. So we use that in our practice all the time. We've been using it for a couple of months. We're also looking at working with our close partners on having them use the tool in our organizations. And we're also looking at having perhaps other areas that have social prescribing programs throughout Alberta use the tool. So really the hope is we're using the same tool throughout Alberta in our practice. And that's kind of an amazing thing to have a streamlined tool that we're all using. We're also just speaking from the same language, so to speak, which is really great. The next area is community engagement. So we do not do this work alone. We engage with many community partners, like the multicultural health brokers, GEF Seniors Housing, Drive Happiness, Strathcona County FCS has come on board as a partner. But we also developed a seniors advisory committee. And so that's a committee of older adults who we turn to for them to kind of help advise us on certain elements of the project. So yesterday, our workshop that we hosted was our first seniors advisory committee meeting. And we asked folks to work through the self-assessment on the portal using Chromebooks and iPads, which was a great experience. And so they're giving us that initial impression of what they think the tool is like in action from folks who really it's developed to support. So having them integrated in the project is really, really great because we're hearing from folks what they think, which is what we need. And sometimes we forget to incorporate those voices of people we're actually trying to support into the work that we're doing. So that's a really integral part of this project as well. The next part of the project, so that's that Max Bell Foundation funding that's coming up. And really that's about scale and spread of the tools. So like I touched on working with our community partners, and then we've been up with them more broadly on spreading the assessment tool. Then there's a project evaluation component, which is really just us evaluating the work, the tool itself, how it's going with implementation into community, within Sage, working with our partners. So by the end of November, we should have a pretty robust report about how that went. So it'd be really great to come back to this group and just talk about some of those things and learnings. We're already learning as we go. And then another piece of this project is just knowledge mobilization. And really that's doing things like this, where we go into community and talk about the project and share some of the information about the tool itself. And yeah, attend conferences. We went to the summit, Michael UMC in Calgary, and did a little presentation there. So yeah, we get to do kind of fun stuff like that, which is nice. So with regards to the assessment tool in particular, I touched on this a little bit. What makes it different than normal comprehensive geriatric assessments is that it takes into consideration all of these things. So the social determinants of health, personal well-being, safety and security, social engagement, mental health, physical environment, and physical health. Yeah, I think we kind of covered that. So this is what the tool, okay, I have to preface, this looks a little rough. This is the first iteration of the Healthy Aging Asset Index tool. So this is what our frontline workers actually use in practice. It's just a document and it's integrated into practice. So it's really conversational. It's not scriptive. So we don't have like a script folks are expected to use. These are just kind of the questions that they touch on. And then based on those questions, people get a score, and from their score, we can kind of tell where they're at on a certain spectrum, and we know what supports potentially they may need. So perhaps they need more connectedness to community, or perhaps they need housing support. We're just better able to see from this assessment what they need. But really the strength lies in, the hope is that there's reassessment, 3, 6, and 9 months, so that we can see, okay, did those interventions help? Did that connection to community make a difference for you? We're really able to assess, if those interventions made a difference or not, and where the gaps are. I would like to say that we're working on getting this professionally designed. So the look and feel, I think when we're showing it in community will be a little bit better, but it's, yeah, that looks a little rough for a first iteration, but it's coming. We also have the virtual frailty screen. So this is something that we introduced during the pandemic, and it's adapted from the clinical frailty screen. So it's essentially what we do is we ask folks these questions, and then based on these questions, we're able to identify which older adults are more at risk of experiencing frailty or not. And it's just a really great way for us to identify what individuals may be at higher risk. Okay. Laurence, I've talked enough.
So nationally, all regional centers for healthy aging are required to organize their interventions and services by the VOID framework, which the CFN has developed. So it's a community driven health intervention aimed to support healthy aging. And again, Carlina mentioned this already, but the Avoid Frailty framework uses the term frailty, which just describes a condition of reduced function and health, but again has that stigma and connotation. So At Sage and Narsha, we prefer to use building resilience or living well community. And the Void framework is an acronym describing strategies to help everyone basically avoid frailty. So these are factors that are that can influence health for all people, but especially those in later life. So broadly, I don't know. I'll get into all of them, I guess. So first is activity. So we know that the staying healthy requires activity and exercise, which can slow frailty and can even reverse frailty in some instances. Vaccinations. So vaccines are safe and effective, and they greatly improve your ability to resist infectious disease and avoid illnesses. For optimizing meds, that's really about managing multiple medications. So 1 out of 4 Canadian adults over the age of 65 take at least 10 different types of medications. So it's important to have your healthcare providers, like a pharmacist, take a look at your medications to reduce like any interactions causing side effects that may have an effect on you. Interact. So social interactions, we know that's meaningful for older adults. Those who have strong social relationships enjoy a better quality of life and often live longer. And then finally, diet and nutrition. So getting proper nutrition can increase your health and well-being. Yeah.
Okay, we have a short video. I'm just gonna, should be. Sorry. Okay.
Yeah, so this video will illustrate the defensive living framework with a healthy aging portal that we'll be talking about. Some of the information there is specific to the interior region, so just don't pay attention to the phone numbers on there.
Are you wondering how to best take care of yourself as you age? Do you want to learn more about healthy aging? The Avoid Frailty for Healthy Aging program is here to help you. The Canadian Frailty Network has introduced the Avoid Frailty Healthy Aging program to help older adults connect with community resources and develop habits for healthy aging. Our free program features an interactive online assessment tool, educational modules, and a library of community programs and support services. When you join the program, you'll fill out an assessment to help you understand how you are doing and where you can make improvements for healthy aging. You'll receive a personalized report with recommendations for reducing your health risks and tips and community resources to help you develop an action plan for staying healthy. If you aren't comfortable using a computer, we can help you fill out your assessment by phone. Once you've received your report, you'll have access to a number of resources that can help you address the risks that are shown in your report. Our educational modules will help you develop your health goals. Once you've done that, you'll be able to create a personal action plan to help you track your progress. Our supports include peer coaching, educational modules, and a library of community programs and services. Peer coaches are available to help you stay on track and support you on your health journey. You can also be trained to be a peer coach. Get healthy and stay healthy. Register today for the Avoid Frailty Healthy Aging program.
So the video showed the Healthy Aging portal. Again, it's a free online platform with information, tools, and resources aimed for older adults. So folks can complete their free healthy aging assessments at their own pace, with the goal that it's to be done independently. But there is support available for those requesting it. And the portal is broken down into 5 different mini assessments. And they all aim to identify areas to strengthen your health and well-being as you age. So after taking the assessment, you'll receive that tailored report. based on the avoid framework, and then it'll give you kind of what areas you may be doing well in already, and then some where you can get better. There's some educational modules and community resources that you can access to increase your score in one area. So referring to your personalized reports, you can access these resources specific to your needs to enhance your well-being as you age. So these resources, educational modules, and then there's a database of community resources. And it's great because there's a map on there as well on the portal. So you can look at community resources that are close by to you if you're seeking them. And then you can also create action plans like the video showed. So you can track your progress right in the portal. And there's options for reassessments as well, I think 6 months after you take your initial one. So the goals for the Healthy Aging portal, really it's aiming to identify seniors who need supports to remain healthy and age well in their community. But additionally, we're hoping to support community resources and interventions all across the Edmonton zone. So this includes supporting community-based senior serving organizations like SAGE in their work to enhance the well-being of older adults. And it's also focused on gathering data to inform decision making, focused on seniors. Looking at a local and provincial level to affect policy making for funders at governments. Yeah. Does anyone have any questions about that?
So I thought maybe at this point of the presentation, we could just, if we could stop recording, and then we can kind of do a bit of a discussion.